Hey everybody, this is Shane, and I'm a fat loss specialist at Pulse Personal Training, and I'm here tonight with Dr. Stephen Gradwohl from Optimal Health Center located in Overland Park. We're going to learn a little bit about what they do over there tonight. Dr. Steve, how are you doing?
I'm doing great.
Cool. Can you tell me a little bit about who you are, what your background is?
Well, I've been in practice now 30 years. That's hard to believe. But 30 years, we've been in our location, either Lenexa or Overland Park, for all that time. I originally studied chiropractic at Cleveland Chiropractic College, and since that time I've spent time specializing in chiropractic orthopedics, sports medicine, enzyme therapy, and a lot of different type of musculoskeletal like ART and neurokinetics, as well as acupuncture. So there's a lot of diversity there, but really we're trying to improve the function of the person's health with digestion, with movement. So really they're opposite sides of the same coin, the function and the nutrition, the function structure of the body. So that's how we look at things to try to bring the best health that we can to people.
Yep. I think a lot of people are probably familiar with chiropractics in terms of like getting the neck popped or the back popped, little adjustments in the bones and stuff like that. So probably don't have to cover a whole lot about that, but you mentioned the nutritional aspect, and that's something that a lot of chiropractic offices don't really get into, that kind of stuff, because it can be kind of a quagmire. You get into that type of stuff. So what is the nutritional aspect of what you guys do? What is enzyme therapy?
Well, we do focus our nutrition on enzyme therapy, and the reason why is enzyme therapy helps us deliver nutrition past an incompetent digestive system. And if you ask me, is there a nutritional fountain of life, I would tell you, well, no, I'm sorry. But I will tell you the closest thing that I know to it from a nutritional perspective is enzyme therapy, because enzymes are the workers. Carbohydrates, fats, proteins, minerals, vitamins, nutrients, those are all like building blocks. Very, very important, but enzymes help activate it and help it work. So that's how we got into enzyme therapy, because we realized that we would be doing nutrition on some patients, and it would work on some people, but it wouldn't work on other people. And we realized that the denominator really was that we couldn't get it past their digestive system or into their body, and so enzymes helps us do that.
So essentially, it may be that you could be eating technically correct on the outside in terms of putting in the right foods. But what's happening once it enters beyond what you can see, you may not be getting everything out of it? Is that what you're saying?
Yeah, that can actually happen. Obviously, the average person that comes into our office isn't eating the right foods to begin with. They're not eating the right nutrition to begin with. And so adding the enzymes in it and then correcting certain aspects of their diet is where we go. Every once in a while, though, you'll have a person who's doing all the right things. I'm doing all the right things, but I'm still having a problem. And so then we start looking at what's the dysfunction? Where is the problem at? And we utilize Dr. Loomis's work, or Loomis enzyme protocol, for testing those things in basically in a physical exam type of method.
Okay. When you talk about digestive problems, if someone wasn't sure if they might be someone who has an enzyme deficiency, what kind of things are people coming to you for? What kind of complaints do you get?
That's a great question. What we usually see is symptoms that you may not be digesting well would be gas, pain, or bloating. Now notice I said pain. Pain that is in a joint system, that could be a sign of enzymatic deficiency. So you could actually have joint pain. And joint pain, I mean, it can be a sign of other things too, but that's why we examine and figure it out. But if all the other things that can cause joint pain are ruled out, then it actually can be a sign of enzyme deficiency. Constipation, diarrhea, headaches, those are all signs of muscle pain. That's perhaps you're working out and you're getting sorer than what you would think that you should get sore, or sorer than your peers are getting sore, or it takes a long time to recover. Those would be signs that perhaps there's a enzymatic deficiency, and it should be a look should be taken.
So when someone's coming in for something like that, is this something that you have to come in office? Or are these going to be, is it an injection? Is it a pill? Is it something that they're taking home, or do they have to come see you for every time? What's a path for correction on something?
Path for correction is we typically will do an examination, and we have shorter or decreased time examinations. It could be maybe a half hour, and then we have a larger one where we actually bring the patient in fasting, and then we examine them and then challenge them with different foods and examine them again. We never utilize injections. The nutrients that we would prescribe would be natural things that I might want them to eat. You need to correct your diet in this way, and you need to correct these types of things and quit eating this. It becomes sometimes a negotiation, because it's like, well, we can give you nutrients and enzymes, so it would be a tablet form, but we could give you less if you were to do this. Okay. And I'm sure in your line too, it's sometimes a negotiation of what the client or the patient is willing to do and what their goals are. What are their goals? What do they want out of this?
That just triggered something in my head. We've had a conversation before. If you wanted to do it nutritionally, I'm going to say the phrase, and you're going to know where I'm going. Live foods.
Live foods, absolutely.
Right. There are certain ways that you can ensure that you're actually getting enzymes from whole food sources. Because if I'm not mistaken, certain preparation methods denature your foods.
Yeah, if you overcook things, I don't eat canned food because you destroy everything. And then when you overcook things, like your vegetables, you want them to be crisp and green. And if they look gray, you've overcooked them and you've destroyed all the enzymes out of it. So, if I have a patient that comes in and they go, I don't eat vegetables. Those are the sickest people on the face of the planet. And the next person or next population that is just as sick are the pastatarians. And you go, well, what's a pastatarian? What a pastatarian is a person who thinks they're a vegetarian, but they eat pasta and they drink pop and then they eat a little bit of vegetables. They just don't eat meat. That is not a vegetarian. That's a pastatarian. And if you choose to do that, that's the sickest people on the planet, because you can't get the nutrients you need. And then by all the carbohydrates they're eating processed like pasta, not that it's bad, there's an appropriate time, but it'll just rob you of your calcium. So these people are really a mess. So we have to determine what are their goals, what are they willing to do, and then how we can come in and help them achieve what their goals are in a reasonable way. Usually with a supplementation and tweaking the diet. For some people we have to tweak a lot, other people we just have to do a little bit.
Okay. When it comes to, like you were mentioning, that pasta may not be right for you, it's just safe to say that maybe something like whole oats may be better than pasta, but at the same time, those are still not going to be a live food in the way that a fresh stalk of broccoli or maybe some carrots would be. So there's kind of a sliding scale of how processed something may be and how easily it is broken down in your body, right?
Exactly. So, obviously eating like, steel-cut oats or things like that are very good for you. There's a lot of health benefit to it. But eating live, fresh foods that actually provide you with those enzymes, you're only going to find in live, fresh foods that you haven't totally destroyed in a cooking or processing process.
You had mentioned at one point, and I love talking about this because sometimes it freaks people out, that sometimes eating your vegetables is about feeding the things inside of you.
Oh yeah.
Instead of feeding yourself, right?
Yeah. When we think about it, when I first was in chiropractic school, if you went back and grabbed the medical textbooks of the day, they talk about in the intestinal system that there would be thousands of different types of bacteria, and that they would be in the hundreds of thousands. And then as I got out of school, then those hundreds of thousands became millions, and then billions, and then trillions. So basically, if you look at your body, you have 10 times the amount of bacteria on your body. Now, when I say on, your digestive tract is technically outside your body. It's a tube.
It's a
tube.
Interior space that exits at both ends.
Right.
So it is an external environment in some ways.
Technically outside your body, right? It's inside your body, but it's outside your body. So the bacteria that live on your body and inside the intestinal tract outnumber your body 10 to 1. So it's in the cellularly. If you count how many are in your body and how many cells that are chained with your DNA, 10 times that live inside your intestinal system and on the surface of your body. 10 times. So, you think about Matrix, I'm thinking about Matrix Reloaded. I mean, Rake just reloaded, that's a lot of life there, if you will.
There's a whole world in there.
It's a whole world
that doesn't realize it's running around inside of you even.
And I wasn't kidding about the Matrix thing, because what we're finding out now in the research in the microbiome is that that they actually can send signals to your brain and affect your mood. And perhaps could be what's telling you, hey, you need to eat that sugar because we're hungry, we want to eat. And so they're tying it to obesity, they're tying it to a lot of things, even in hypothyroidism and some other types of conditions, and even in some aspects of diabetes, that this microbiome gets altered, and so then it changes how you want to eat, and it actually changes even how you process food. So it's just amazing, particularly with food allergies or food sensitivities. So it's an amazing world, and so if you put crap into it, you're going to get crap out of it. Probably pun intended.
Right, in terms of performance and in reality, right?
Yeah, exactly.
You mentioned food allergies, and it's very in vogue right now to avoid gluten and to cut things like that out. Is it safe to say that a lot of times you may have people coming in that are self-diagnosing with things like gluten intolerance, when in reality it may be a whole series of things that could be off, and it may be certain foods that trigger this, but it's not necessarily what their expectation is. And you guys are capable of doing a specific test to measure those values. It's not just guesswork. You guys are taking samples and you're able to measure whether or not you're processing those things, right?
Correct. In most instances, now sometimes gluten intolerance is sometimes initially hard to diagnose, but a lot of people that don't do well with gluten, it's gluten sensitivity, so it's not like a celiac. Celiac is really obvious. But those people really will suffer when they eat it. Other people, they'll I get a headache, or I feel this way, or I don't feel well, or I get gas. Those are signs that you're not digesting well. And when a person doesn't digest well, sometimes those molecules of gluten it's a protein, and it just can't get broken down enough, and so then it can stimulate and create sensitivity, as in many other types of food sensitivities too. So
that's dairy and some other things like that.
Of course, we really aren't designed to eat as much dairy as many of us do.
Sure.
Too, and so there's a threshold that you eat too much of it, your body's going, I can't do anything with it.
That sounds about right, because I get, some people think that it may be one thing when in reality it could be a series of small things interacting with each other that come together to seem like
multiple
one larger
sensitivities
problem.
Just create too much inflammation in the body, and the body just reacts to it.
Okay, that is a lot of the common things that you'd expect to hear from people complaint-wise with the headaches and stuff like that. But it's interesting because the typical response from someone who's been to a chiropractor is, I went in and they popped my neck and I feel better. But it sounds like there may be a hell of a lot more in terms of really looking at the whole body, trying to figure out what it is. And it could be spinal health, and it could be soft tissue management. But if you're not maintaining the environment inside of you, you may be leaving it on the table in terms of being able to recover from the treatments you receive even.
Yeah, the thing about it is we talk about spinal adjustment, and remember that the spinal vertebra and the neurological system goes to all the organs, right?
Yep.
So chiropractic has always taught that in fact, and we don't ascribe to this, but in the old days they'd say look well to the spine because all disease comes from the spine. Now we don't believe that. That's not the case, but we do recognize that many times organs will dysfunction because it doesn't get the proper nerve supply or energy that it needs to get. But vice versa is true too. So I could work on a person and they'll and work on their spine, and all of a sudden they go, gosh, my digestion is better, my bowels are better, everything's better from spinal treatment. But the same system, because it goes from the spine to the organ and the organ to the spine. You could have a person who goes, gosh, my back is always out in this spot all the time. I'll get adjusted, it feels better, but it keeps on going out. That could be related to the digestive system. So the digestive system isn't working correctly, or an organ system doesn't have the nutrients. We're not talking about pathology, but they don't have the nutrition, so the organ system is under stress. And so then that can create pain reflexing back to the spine. So if you have a problem that is just not going away, it actually could be a digestive nutritional or other type of problem besides just adjusting the thing, same spot in the spine, over and over again.
Just that weekly or bi-weekly adjustment that
yeah,
you just
you're
stop
like,
by
wait a
and get it
second.
done.
Yeah, wait a second. What else is going here? As we know with movement, there could be other places in the movement chain that aren't working right, and that's where the problem is. It's being missed. So a good movement exam will show that. But on the same token, it could be a digestive problem or a nutritional deficiency to an organ that keeps it going. So that's why we want to look at it wholly, and we don't like just to put people on the table and just adjust them over and over again. That's almost the definition of insanity, in my opinion.
Just making the same attempt to fix a
Just
problem.
do it over and over. Yeah.
That sounds about crazy to me. I would think after the third adjustment, then maybe we would want to start looking at something else.
Well, you want, sometimes it'll take, anywhere from, 3, 4, 10 adjustments to start improving a motor unit. But you have to have a firm diagnosis. Is this coming from emotion? Is this an injured joint? Is this coming from a nutritional? It could be any of those things, and we don't know until we examine and look. I always say test, don't guess.
Sure.
Figure it out.
And retest when
Retest, and then
every
yes,
time.
if you've got a parameter, then come back and look at it. Is it gotten better? Are we getting closer to where we want to be, or further?
Measurable change.
Measurable.
Not just anecdotal feedback, but a
Right.
measurable change that
What
you
is-
can statistically mark somehow.
Yeah, exactly.
So if someone were dealing with any of those things, ranging from simple neck pain or indigestion and things like that, where would they go to find you? Where are you guys located at?
We're College of Quivira at 11791 West 112th. That's in Overland Park, and our practice is called Optimal Health. And our phone number is 913-888-3338. I had a friend tell me, that's 888 feet. I go, really? All right, we work on feet too.
That's excellent. If only I had the letters on my numbers.
Yeah, exactly. We don't have that anymore.
I haven't seen a tri-touch phone in a while.
I'm aging myself. I've
little
just
bit.
aged myself.
Website is www.ohckc.com. Dr. Steve Gradwohl, thanks for coming in, buddy.
Thank you so much.
Be sure if you guys have any problems with anything you need checked out, go to Dr. Steve's website, www.ohckc.com. This is Shane from Pulse Personal Training. Thanks for watching, guys. Have a great night.